Hello everyone, welcome to the Elementary Knowledge. Today, we're going to talk about sickle cell anemia. Well, what is anemia? Anemia is the low capacity of blood to carry oxygen and nutrients around the body. Sickle cell anemia is a disease in which body makes sickle-shaped red blood cells instead of normal biconcave red blood cells. This is the diagrammatical representation of both types of cells. On the left side, you can see the biconcave normal red blood cells, and on the right side, you can see the sickle-shaped red blood cells. In sickle cell disease, the body makes sickle cell hemoglobin HS instead of normal hemoglobin, hemoglobin A, represented by HA. And whenever oxygen level drops inside the cells, this abnormal hemoglobin, that is sickle hemoglobin, joins together and aggregates, and this aggregation changes the shape of cell into a sickle, making them prone towards breaking. And once the cell is broken down, it loses its capacity to carry oxygen and nutrients around the body. And this is called anemia. That's why the patients having sickle cell disease suffers from anemia. They also block the microvasculature, thus blocking the blood flow towards that area. Normal hemoglobin. Normally, our red blood cells have hemoglobin A, and it has 4 chains of proteins, each linked with an iron-containing compound called heme. 2 chains are called alpha chains, and the other 2 chains are called beta chains. In this diagram, all the 4 chains are shown, and each chain is having a heme, that is, an iron-containing compound. Sickle hemoglobin. Sickle hemoglobin is made when there is a defect in beta chain. It's a defect in beta chain that is due to point mutation in beta chain gene. Well, what is point mutation? A point mutation is a mutation in which there is a change of only single nucleotide. There are 2 genes that are responsible for the beta chains. If the defect is only in one gene, it will give rise to a milder form of disease called Acadia state. But if the defect is in both genes, it will rise to a sickle cell major disease. And this form of disease is very severe and very symptomatic form of sickle cell anemia. The defect is actually a change in amino acid sequence. In beta chain, there is replacement of glutamic acid having hydrophilic property with that of valine having hydrophobic property. The change of this property makes the hemoglobin prone towards aggregation whenever there is low levels of oxygen inside the cells. Below the diagram is showing both hemoglobin A, that is normal adult hemoglobin, and hemoglobin S, that is sickle cell hemoglobin. As you can all see, the hemoglobin A contains glutamic acid, and in sickle cell disease, this glutamic acid is replaced by valine. This defect in beta chain leads to aggregation and joining of beta chains with each other whenever there is low oxygen levels inside the cells. The major form of disease is severe because both beta chains are defected, and the person suffers from blood crisis because the sickle cells are easily breakable, leading to anemia. That is why they require regular blood transfusions. Well, in minor diseases, whenever there is a carrier state, persons become symptomatic only when there is low oxygen supply, such as when the person is on high altitudes or when the person is under stress. Let's talk about the symptoms of sickle cell anemia. Of course, the person suffers from anemia. Why is that? I've told you already. The easily breakable cells have low capacity to carry oxygen around the body. That is why they suffer from anemia. They also suffer from pain. This is because the microvasculature gets blocked and the blood supply towards that area is blocked. And whenever there is impairment of blood supply, the symptom is pain. They also suffer from frequent infections because of non-functional spleen. The spleen doesn't function because its blood supply also affected by sickle cells. And you know that spleen plays an important role in immunity, and when this role of spleen is lost, there is high frequency of infections. And there is another thing called hands and feet syndrome, and that is nothing but the pain and swelling because of impairment in blood flow towards hands and feet. Let's talk about the treatment options available for sickle cell anemia. Hydroxyurea is used as it maintains the round shape of cells and helps them to remain bigger. This is because it makes fetal hemoglobin. Fetal hemoglobin contains alpha and gamma chain, and you all know that in sickle cell disease the defect is in beta chain. The fetal hemoglobin doesn't contain beta chain, that's why it doesn't get affected, and when its quantity is increased in the cell, it helps the cell to remain bigger and maintain the round shape of the cells. And for the pain symptoms, you can give the patients painkillers. And for anemia, you can give them regular transfusions. Well, the absolute treatment of this disease is bone marrow transplant with a healthy bone marrow. In case of carrier disease, avoid low oxygen levels such as high altitudes and stress. For coping with infections, you should give them antibiotics and vaccination against infections. Thank you guys for your patience and listening. Kindly subscribe to our channel, like and share our videos. Stay tuned for more informative videos. See you in the next one. Till then, have a good time and take care. Bye.